Okay, great. So it's 11 o'clock. Good morning. Happy Tuesday. So our session this morning, problem solving support information, is going to be on the topic of transition services for young adults turning 22 during this time. So welcome everybody. I'd like to introduce our guest. Whoops, sorry. This is Victor Hernandez this morning, and Victor is the Deputy Assistant Commissioner for the Department of Developmental Services. Victor has lots of different hats at DDS, but mainly he is the DDS statewide coordinator for Chapter 688, which is the process and the method that young adults with intellectual and developmental disabilities are referred from school to adult services. So Victor oversees this whole process throughout Massachusetts. He's also the supportive housing liaison for DDS, constituent liaison, and special projects within the DDS 4 regions and 23 area offices. So comes with lots of experience, both he has a master's in administrative education from Harvard University, and also Victor has had a long history of working with youth with disabilities and school programs. He was an assistant area director up in the Merrimack Valley for a number of years. So we're excited to have you join us, Victor, and give us some information all about transition. So sure. I just thought we could, if you could just let us know what the current status is in terms of adults turning 22.
Sure. And also, Kerry, something you left out, that you and I have worked together for quite a while, and it's been a terrific relationship. So that's why I was very happy.
Thank you.
Very happy to respond when you asked me to. Yes, the current status of adults turning 22 in Massachusetts is it's interesting because, when the shutdown hit around March 16th or 17th, all of a sudden we had to figure out how we're going to close over 2,700 group homes serving over 10,000 people, and also keep making sure that our individuals and the staff were safe. But during that time and continuing so, people were still transitioning. People were still leaving school. They were still graduating. They were still turning 22. So their entitlement was ending. And for transition, those are transitioning, and also too for the people that we serve, we immediately knew that we had to find ways for our service coordinators to reach out for all those individuals. So we purchased laptops and cell phones for each of our service coordinators so they could connect with people. And they immediately started to reach out to everybody on the caseload, including those transitioning out of school. What we did also was come up with a roster and of everybody who is scheduled to leave school or turn 22 from that point on, and up until the end of August. So we have a list of individuals, where they're at, the current check-in, how they were doing, if they needed anything, if they're living at home, if they're living in a residential school, how is that working out? Any problems with them staying with the residential school? And we consistently update that list to make sure that we're attending to people at the best we can. But the only certain thing we can say about what we're going through right now with this pandemic is that there's uncertainties. But we are working closely with our provider agencies in order to be able to see what we can do to provide whatever services we can. For those who are transitioning out of school, and also those who are still in school during this time, we expanded our family support for all the individuals, but particularly those who are currently in school or transitioning out. So that way we expanded the ability for family support, but also made it more flexible, in terms of what do you need right now? What can we do to provide it? We weren't able to do everything we'd like to, but we really would like to be able to support the individuals and families that the best we can. Also, we have about weekly, if not every other week, conversations with Department of Elementary and Secondary Education, DESE, particularly the Special Education Department, in terms of who that they know will be leaving school that we may not know, because sometimes we don't know unless people tell us. Also, any issues or problems. And I have to tell you, DESE has been absolutely terrific to work with during this time. They've been open, communicative, collaborative. It's been a terrific working relationship we have with them. Also, during this time, if you remember, the Board of Education waived the MCAS. So what did that mean for our individuals? Individuals that we thought that would be in school for another year or two, but all of a sudden, because they waived MCAS, they met all the other graduation requirements. So that was something that we had to look at, and we polled all of our service coordinators and also with our school systems, and we found out that actually there wasn't that much of a dramatic impact on our numbers. Overall, that was less than 20 individuals, 20 people that we found that really were leaving school early. So it wasn't that much of a dramatic impact that we thought that we would have. But we worked closely with DESE. They were very helpful during that time in terms of providing us information, providing us the graduation requirements, the guidelines for this. So we worked closely with them, and it was terrific to work with. We met with service coordinators, the transition coordinators, every other week. We still do on a regional basis. In terms of their experiences, their experience with transition, their experiences in working with the school districts, their experiences with the meetings, they're done remotely. How is that going? And overall, I have to tell you, they've been working pretty well. Talking with the service coordinators, they've all said that they have had excellent, for all intents and purposes, just about most of them, if not all, have had great relationships with the school districts. They're communicating, they're having meetings, they're having IEP meetings, they're having individual transition planning meetings, ITP meetings. And many of them have actually come out and said pretty much that they're actually attending more meetings than they normally would remotely. One service coordinator who works out of the Walpole office said, I'm having so many meetings now because normally before that, I was always stuck on 128. So she's attending much more meetings than she thought that she would, she experienced this before. So overall, it's been a great relationship, and it's worked very well. In talking with, the service coordinators in terms of what can we do in order to be able to help the transition process for you, we heard that it was difficult to try and introduce families and individuals to some of the services that we provide, because right now, you cannot do visits. Cannot do any visits to programs because there are no programs. They aren't up and running yet. So you really couldn't do that. So we have, and I'm going to refer to the DDS website a few times during this, but we have a Real Lives link on our website. And in that, I don't know if you've ever been on it, but you should. It's a terrific website. that people can see what programs are in their areas based on their service needs or service interest. And we are currently compiling any videos that the agencies have of their programs. I'm going to put them on that website. So that way, if they have a promotional video about their agency, or if they can, we ask them if they can maybe just do a virtual tour of their agency. So that way we can put it on there for individuals and families. And that's something that is a way that we can hopefully at least begin to introduce individuals and families for that. We've also expanded during this time our self-directed model, self-direction. And Kerry, I think that this would be a great future topic for your group, is to have somebody from our self-direction program talk about self-direction, because right now it's something that is available to people instead of waiting for things to reopen. It's an option, and it's a more readily available option for individuals right now, but people can put their services into their own hands in terms of what it is they like to do, and we try and provide a system where we try and meet their needs and meet their interests in terms of what it is that they would like to do with their life, and with the availability for them for services. So that way they're not depending on our services, they develop their own services. So it's a great model, and it's something that I definitely reach out to people to really look at. And there is a link on that, their self-directed model, on our website, with some videos of people talking about their self-directed programs and what they've been able to do with it. And it's been very, very terrific. I just wanted to quickly talk about where we're at right now with the opening of phase 3. Because people have transitioned. We've heard from families, they would like to get their loved ones get started into programs, but the programs have just received their guidelines on how to open, and those just came out last week, last Thursday or Friday, I believe, and those are on our website as well. And it's going to be a slow reopening. So that's something that families should really be aware of, and I can't stress this enough, is to reach out to your area offices in terms of what the plans are for your loved one, and what is available for them during this time, because the reopening is going to be very, very slow. We've so far have done very well with the way we've handled the COVID process, the pandemic, excuse me. And that's something that we have to make sure that we continue. So we worked closely with our provider agencies. So we had work groups around every phase of our day programs, like transportation and health and safety, and developed a set of guidelines in terms of the reopening process. So that's something that is going to continue. I mean, the life as we know it right now is going to continue for a while. So we need to make sure that those who are transitioning out of school in the future, but also too now in the past few weeks, continue to have some supports available for them while they're waiting for their other programs to begin. And again, I stress the family support in the self-directed model. The 688 process, we've worked closely with DESE on, as you know, what initiates the 688 process is a 688 referral that's initiated by the school systems. Well, school systems shut down too. So we've been working with the school systems along with DESE to make sure that the 688 referrals are being processed. We've worked with them in making sure that we have those, because that helps us justify our budget needs, but also too, there are many individuals who we don't know about. And that's how we learn about them, is through the 688 process. So it's important that we receive those 688 referrals. And for those of you who have loved ones who you think would be transitioning within the next 6 to 18 months, it would be good to do everybody a favor, including your loved one, to check in with the school system to make sure that a 688 has been filed on their behalf. So that's something that I really would like to stress that it's being done. We're going to continue with the how we're handling things right now in terms of looking at when people are transitioning out of school. And again, I have it up until the end of August. I probably might extend that now up until the end of September. But we have, again, a listing, individuals, where they're at, they're living at home, they're living in a residential school. The last check-in, how has that been going? Any problems? What's the area office doing about it? Anything we can do? And it's important that we maintain that check-in with how people are doing with the transition process, because this is different. It's been totally different than probably what many people were anticipating. When they've heard from other people where, there were agency visits, they talked with different people, they saw different programs. Well, that's not happening right now, unfortunately, because of the pandemic. So we want to make sure that we have that connection and we have those opportunities available to individuals and families. So I've touched upon a few things. Hopefully you know that we are looking at transition, that we're exploring it closely. We're tracking people. We are in constant communication with DESE if there's any issues. Service coordinators have reaching out to all of you on their caseload. We're working with the school districts, the meeting with the school districts, and we are doing everything possible to make sure that, when an individual is done with school, that there's a warm handoff. We have a lot of people who are transitioning out of school during this time. Also, for this current year, we anticipate well over 1,300 people transitioning out. So we need to make sure that even the ones who may be transitioning out months from now, that they are still on our radar, that we have plans for them, and that we are ready to be able to work with the school systems as we get closer to the transition in order to be able to have something available for them. And if the reopening plans work out, then, hopefully there'll be more and more opportunities, programmatic opportunities we have for people. We are looking at remote and work with the individuals as well to see if that's something that will work well for them. So, I don't want to spend the whole time talking, but I would love to be able to hear what questions that people have in order to be able to, I can answer them, or at least be able to direct you to the best place to, have your inquiries fielded. So I'd like to hear any questions that people may have.
Yeah, thank you, Victor. That was great. Good overview. So good to know that DESE and DDS are working hand in hand during this time.
Absolutely.
And that also, the website and the opportunities for self-direction are terrific. So thanks for sharing that. So if anybody wants to ask a question for Victor, and you can either chat it in, or you can unmute yourself and ask it directly. I was curious, Victor, about some students who were living in residential placements and can't return home at this time. Are they going into other residential, or is school keeping them? And
well,
who's paying for that?
Yeah, that was a huge issue initially. Because, and again, there's, like for everything around this pandemic, there's no playbook.
Right.
There's no playbook. All of a sudden, boom, this hit, and what happens? So we worked with DESE on this from the start. I mean, they're very responsive. That's one of the reasons why we did a listing of everybody who's transitioning, and also made sure that, looking at who's in a residential school and what are the plans for those people, what's being worked out. And there are a lot of schools who, we're saying that, well, and again, our individuals cannot transition out, let's say, to a group home or another shared living situation or another situation because there is no visitations. We're following CDC guidelines, and there could be no visitations. Or if somebody left the facility, even if it was for a dinner visit, they wouldn't be able to go back. So pretty much, we didn't have an established place for people to go to or a mechanism for them to go back to. So we worked closely with DESE, and so we had residential schools telling us that, so-and-so had to be out by a certain day because he's turning 22 that day, and according to regulations, we can't keep that person. Well, DESE was very responsive. That's why we needed to know who everybody was in a residential school, made sure they're all set. If there was a problem like this, we would call DESE. DESE would call the residential school and tell them, look, we're relaxing those regulations right now because of the pandemic. Work something out with DDS to make sure that, they will pay, during that time, post-22, and what the plans are and everything like that. So we had a few of those cases. Every one of them was worked out. Every one of them, DESE was extremely responsive and working out with the residential schools. The residential schools themselves, again, they didn't really want to kick anybody out. They were just up against a regulation, and they're very workable. So this is something where the benefits was of early detection, early communication, and early resolution really worked out well. So yeah, that was a problem that came up very, very quickly. We with our work with DESE, we were able to work that out. And there were some people who were able to go to places because before the pandemic hit, they were in the process of transitioning anyway, or orienting themselves to their group home or their shared living situation. So we were able to work something out. But overall, it was an immediate concern. But the early detection and early communication with DESE really helped that situation out very well. So we were very, very fortunate.
That's great. Good to know. How about anybody else? Anybody else have questions for Victor? And I'm just curious, any parents on the call who have loved ones who are in the transition process, and how's it going for you?
I have a daughter that just turned 18. And I'm really missing the support groups. I'm really missing the opportunities to be with other parents to help me walk through this process. Yeah. I'm certainly missing we had a very nicely structured program where she was getting a lot of her recreational activities through the ARC because she was unable to attend full-day school because of her medical condition. So I had spent like all year building this great program that was a good fit for her. She was using a transition age vocational program that was very social for her. She was using the ARC recreational programs. And then the school was providing some wonderful things in terms of her academics, and she's not doing well. She lives at home with me, and obviously, and I'm really struggling with how to meet her needs for social interaction now that all the structured activities I had her in for social interaction are just, it sounds like they're not going to be happening anytime soon, if I am correct.
That's something that we heard a lot from families. They were concerned that while in school, their loved ones were doing terrific, made some great strides, and all of a sudden, come March, a lot of that, again, these are people who, individuals, students who benefited from the structure, the one-to-one attention, and really slipped in terms of their skills. We also heard from families that the social connection, and by the way, the work that Kerry's doing here. And other stakeholder agencies as well have done a terrific job in having weekly Zoom calls for families to connect, reach out, ask questions. It seems to be happening everywhere. So it's, people have really, stakeholders and advocates have really stepped up as well in terms of reaching out to families, providing information, or just having that family network available for them in order to be able to share concerns, but also to share resources and helpful information. That's something that we have talked with DESE about, and we're trying to see what we can do. But overall, it's been a challenge for DESE as well. The districts in terms of their students who are at home and trying to meet those needs, which can only be remote instruction can only go so far. So that's something that they know, and we try with the family support, try and be able to do what we can to help the families out during that time. Somebody had a chat question about the technology available to the individuals. We try and see what we can do with our family support agencies, our family support, to see what we can provide. That's something that if somebody's interested in something, to check in with their family support. But it's something that we have over 43,000 people. So I don't know if we could provide technology to each one of them, but again, it's something that maybe family can say, look, above everything else right now, we might need something, and that's something that they work with the area office and family support agencies on. But one of the things, real quickly, we found, and also I'm on a DDS, and DESE is on a national transition group that has been meeting during the pandemic time, just to get best practices and ideas. And one of the things that we are, taught, there's the state of Tennessee has done a terrific job, and they've pulled us off. We were working with them actually on it, is on virtual transition fairs. So that's something that we wanted to be able to start to implement in September as well for families. But something that really came up there, and when we're experiencing here, is the inequality of availability of the internet services. There are some geographic districts in Massachusetts where their internet is not available. Believe it or not, I was stunned to hear this. So we're working with the area office to see what we can do for those families and individuals. What can be done for them? But that's something that we're finding, that there are pockets in Massachusetts where there's no internet capability. So we're wondering how how they could even have the remote learning with the school districts, or be able to do remote practices with smart vendor agencies. So anyway, that's just some of the things that have bubbled up during the pandemic that just starting to address. So anyway, I'm sorry. I think I may have cut somebody off. I'm sorry.
It's okay. Thanks, Victor. Yeah, I know hearing from lots of families that the DDS and the family support centers have been really, issuing a lot of iPads and Chromebooks so that people can take advantage of virtual learning when they're able. And, just those silver linings always come out too, where how many people were able to engage that way versus, there's people who cannot. And I'm hoping that we're going to be learning that, DESE might be providing some maybe in-home, or I know of a program that's going to be, actually it started this week, that's bringing back their kids who are medically fragile. So just all sorts of things coming up, and lots of creativity, which is awesome. I do want to mention that through the Massachusetts Partnership for Transition to Employment, the MPTE, we are going to be sponsoring a 6-week kind of class over the summer to kind of re-envision what September may look like for your loved ones. So it will be, via Zoom. You can find out more about it by joining the Massachusetts Transition to Adulthood Facebook page. And we're getting lots of interest. It's going to be starting next week. And we're going to be using a lot of the frameworks from Charting the Life course and a lot of the tools to be able to say, okay, what does September look like ideally? And, what do you want to do? What do you want? What don't you want? And how are you going to get there? So I encourage anybody who would like to kind of work with a group of people. It's going to be a lot of independent work. We'll be, on Mondays, we'll be launching a brief video or information about a resource, a framework, a tool, then give you some time to do some homework. And then on Fridays, we're going to have a Zoom chat so that we can share information and just kind of compare notes. So if anybody's interested, just check out that Facebook page. So any other questions here? I don't see any in the chat box. Anybody else want to unmute themselves?
Kerry, can you just say what the Facebook page is again?
Yes, it's the Massachusetts Transition to Adulthood Facebook page. It's a private page, so you have to, you have to ask to be a member, and then we just, everybody gets accepted. Yeah. So I'm excited about doing that. So I'm one of the ambassadors for Charting the Life course. So we'll be launching that this summer.
Yeah, I've heard that.
Also,
Margaret and a few people. Yeah.
Yep. So I just wanted to share Victor's contact information. Where it is. Yes.
Hi, sorry to interrupt. Good morning, everyone. Thank you, Victor, for taking the time to share all these updates with us. I'd be curious to know a little bit more about the expansion you mentioned for the family support centers. Could you tell us a little bit more about that and maybe some examples of the flexibility that the family support centers have been able to work with families?
It's our family support program, not so much the centers, but the family support program. There's a set of guidelines, which are too many to mention for family support, but in terms of some of the turnaround, sometimes there are expenses that would need to get approval, maybe 2 or 3 layers of approval. We cut those back so in order to be able to, people can just, get what they need. We increase some of the allocations for people. Usually there's a process for that. We just weren't able to do that. So I think that now that is starting new again because that was up until the end of the fiscal year, June 30th. So right now, as you know, we don't have a budget. There's no state budget. We're actually, I was just on a call earlier this morning in terms of looking at our, how we're going to, for a budget implementation for transition and everything else in terms of how we're going to work with that. But right now, there's no state budget, so there's nothing to work with right now. But we really try to get some of the, I'll call it red tape, the bureaucratic stuff out of the way. So if families said they needed something, and it was something that, yes, they absolutely need it, we get it. Instead of having to fill out the form, send it up, be reviewed, those types of things. So we try to get some of that out of there as much as possible because, we needed, the families needed it, and they needed it now, So, they couldn't wait because, again, the uncertainty of everything, nobody knew how long this was going to last. So we needed to see what we can do. Make sure that, people are safe and as much tension as possible is addressed. I mean, there's a lot of tension in the homes. I mean, there's some families have lost loved ones. People may have lost their jobs, may have lost their businesses. That's why we have to keep a good ear on. That's why we're really dependent on the ARC and a lot of our stakeholder and advocacy agencies, along with our family support providers, to keep their ear in the ground for us as well, because it's a very tenuous time as well. So that's why we wanted to at least see what we can do to make some of those services as flexible as possible.
Yeah, so my understanding too, Margaret Van Gelder was a guest at a meeting last week, and so family support agencies are told to go ahead and do planning for expenditures, allocations, and that sort of thing. However, they're looking at a shorter window. So they're looking at, you could plan for the year, say you get $1,000. You probably should plan for that 500. Because also, as many of you know, that family support contracts were up for bid. That was put on hold. They're hoping to put it back out to bid. So by January, there will be new contracts and that sort of thing. And hopefully we have some better budget news, which is going to put me into a segue about encourage all of you to go on the ARC website, MassARC, and look at the Don't Cut Us Out hashtag. And we have a really fast and efficient new CQ center that will help send letters to the governor, to the House, and to the senators, and that sort of thing, because we need resources to get programs up and running, to get families things they need. So just really, really important. Last number I heard is that there's been 25,000 letters issued to folks. Wow. So keep up the great work. If you haven't done it, just go to arcmass.org, go to our COVID website, and you'll be able to gain access to all of that information. Really important. So, okay. Any other questions, or are we good? I don't see any in the chat. Okay. Well, Victor, thanks so much for coming on today.
Thanks. I wanted to just tell people just to make sure if you have a loved one, stay connected with your area office, stay connected with your service coordinator, let them know what's going on. We don't know how things are going unless you tell us, or people tell us, so we don't know. But most importantly, too, keep attending and participating in activities like this. Again, our stakeholders and advocates, they keep the ball rolling for us. And I know Kerry, she'll make sure that ball is rolling, particularly towards me. We've known each other very well. And again, it's something that, the opportunities have just been incredible the past couple of weeks, a few weeks and months I've seen for families, chat rooms, and again, the trainings, all that information that a lot of them are doing. It's just been absolutely incredible. And, take advantage of all of them if you can. So that's terrific. And I want to thank everybody for your time today. And also, too, I always enjoy this, and hopefully, got something out of it. And then again, any questions, you can contact your area office, but if something comes up, you can contact me as well.
Yeah, I thought I did a slide on your contact information, but it's not here. So what I'm going to do is I'll be sending everybody out a copy of these slides, and I'll include Victor's information. Victor, do you have what phone number should I put for
Sure.
you?
I always in contact with my desk phone number. I call it at least 4 or 5 times a day, and it is 617-624-7785. 617-624-7785. And my email address is victor.hernandez, that's Hernandez with a Z, @mass.gov.
Terrific. Okay, well, thanks, everybody. I hope you all stay well and enjoy this great day. Take care.
Take care.
Bye-bye.
Goodbye.